Hello everyone. Since the initial days of my practice, I have always posted some of the cases on my social media, but I never posted a video explaining it. From today onwards, I am bringing this series for you all, including my patients also. I will bring this series in which I will explain some cases in very short videos. So I'll name this series as a Dr. Saurabh's Smile Stories. So today we will start with this case. This was the pre-operative photograph of a patient. You can see here, first effect is in a midline. You can see the midline is so improper. Although it is matched with the papilla, but you can see the adaptation is not proper. You can clearly say that band was not used in this case. It was added very roughly. The composite was added very roughly. Patient gave the history that these two tooth had a large diastema over here. That's why one of the dentists built it up with the composite. So this is the direct veneer composite. You can see another defect you can see at the cervical margin. This is typical cervical margin when gingival fluids leak into your composite restoration while you do the bonding and the layering also. So it is very necessary to isolate properly whenever you do the anterior composite. Third thing, you can see the distal margins also, they are not well adapted. The margin is very rough and somewhere it is fractured also, the margin is opening. And the next stage after this will be the cervical caries, because all of the composite which was present here is already gone. Okay. So here finish, you can see the difference between the finishing and polishing of this portion and the finishing and polishing of this portion. This is also one of the possibility in which the finishing and polishing was done here properly, but in this region the finishing and polishing was not done properly. These are all 2-3 reasons which can cause condition like this. Look at this. This is also pre-operative photograph. You can see in the dark the texture on the tooth. There is no proper contouring of the tooth, no proper finishing and polishing. Here you can see the inner tooth. This is the composite and the tooth margin. This is also composite and the tooth margin. And we have discussed about the cervical area also. So by discussing with the patient, I decided to go for direct composite veneers after removing all the old composite. So here with the button technique, I have taken the shade of the tooth. So this is the photograph after removal of all the composite. Now you can see the papilla over here, it is inflamed because the food lodgement was there. I have kept some of the composite layer over here because I did not want to hurt the enamel of the patient. Okay, look at this photograph again. We have removed all the composite. This is the original diastema now. This is the original diastema, and over here, all the old composite, unsupported composite is removed. Then this is the palatal view. You can see huge diastema over here. After this, I decided to go with the split dam technique. I splitted the dam. I did not use any clamps. I just used wedges and placed the dam with the split dam technique. After that, we use 7th generation universal bond. You can see the bonding is done properly. Then we decided to go with the Unica matrix. These are the Unica matrix. Okay. This is the layering after Unica matrices. I added all the layers like enamel dentin and the body shades. Then this is the pre-polishing, that means finishing. I reduced all the excess composite from all the sides, from the proximal sides also and from the incisal edge also. After removing all the excess composite, this was the tooth. Okay, now they are well in shape. You can see here, you can see the translucency also, the opacity and all the natural features are matching. This area is very critical. You have to maintain always a self-cleansing clean area in this region. So I decided to keep it like this only for another 24 hours. In this case, I did the finishing polishing after 24 hours. Okay, so after 24 hours you can see the situation over here. The gingiva is well engineered and adapted with my new composite. Okay, newly added composite. And you can see the papilla also, it is healing. Over here also it is healing. Okay, without polishing also you can see the translucency over here. I have matched the shade very well in this region also. I did not want any translucency in this midline, this proximal area. but I wanted the translucency in the incisal edge area. So I added composite according to that. Then, so this is after finishing and polishing. I asked the patient to visit again after 7 days. So this is the photograph after the 7 days of the treatment. You can see the properly engineered gingiva. Okay, the papilla is completely healed and fitted well into your composite. This is called as the engineering of the gingiva. You shape your composite very well so that your gingiva will form around it. Okay, I have engineered the gingiva here. Now in this case also you can see, in this photograph also you can see the translucency on the incisal edge region. In this tooth also the translucency is only on the incisal edge region, not on the midline, not on the other areas. Okay, the shade is also perfectly matched. You can see the texture also. I have added the texture because look at this, in the lateral there was a texture. I added the texture in both the tooth, and again well finished, well polished restoration will last longer without any complication. On the palatal area also you can see the well placed midline without any staining even after 7 days. Okay, and this is the before and after. This was the before, after the removal of the composite. This was the diastema, and this is after the adding of composite. You can see the gingiva very well adapted to our composite. Now I have added illusion over here so that tooth should not look very wide. Okay, this is the before and after of the palatal view. Again, this is before pre-operative photograph, and this is post-operative photograph. This post-operative photograph was taken after 1 month of the treatment. Okay, you can see now also after 1 month the translucency is as it is, no staining, no calculus formation in the midline, no wearing off of the composite, finishing and polishing is intact. So this was the case for today. I hope you enjoyed this case discussion. If yes, then do follow our page AA Dental Care. Also, you can share this video with your friends. Thank you so much.